Peripheral arterial disease is a disease process wherein you develop deposition of cholesterol in your arteries, which causes hardening, and slowly but surely it narrows the lumen and it decreases the oxygen rich blood supply to the distal part of your foot, and that will result in pain. Especially initially you will have pain while walking, and as the blockage becomes more and more, you start getting pain even at rest. One is the history is very typical, and then the clinical examination which goes with it. You will have decreased pulses in your foot, and also you may also have a murmur on the artery, which we call as a bruit when you listen with a stethoscope. Well, first, before we treating, we have to do certain investigations, and the simple, most common and non-invasive study will be a Doppler study, which will give us the waveforms in your arteries, and that gives me a baseline where you stand. And if your numbers are within a claudication range, which I mean is somewhere less than 1 but more than 0.5, then we treat you with only medications and exercise and lifestyle modifications. But if your numbers are worse and if your walking distance is too short, then we have to think in terms of any kind of invasive treatment like angiogram or angioplasty. And the first line is usually conservative management. The initial signs and symptoms are the people having pain while walking, we call as claudication, and they give very typical history. They can walk certain distance, then they have to rest, and again they have to walk. And as the disease progresses, this claudication distance gets less and less, and they will also start developing other signs and symptoms like loss of hair and color changes, and the skin becomes taut and shiny, and these are all the late signs of peripheral arterial disease. There are certain risk factors. One is obesity, smoking, history of high blood pressure, history of high cholesterol, and also history of diabetes, and in addition genetics. If there is family history of atherosclerosis, you are at risk for developing this process. People who have peripheral vascular disease also have a risk for coronary artery disease, and so people who do get evaluated for peripheral vascular disease also have to be evaluated at some point for coronary artery disease as well. And the risk factors for peripheral vascular disease are also the risk factors for coronary artery disease, and risk modification will help both disease process. For people who are seen in early phase of peripheral arterial disease, risk modification and also with some pharmacological treatment, you can delay the process significantly and also increase their walking distance. And the risk modification is, of course, to stop smoking, reduce weight, good diabetes control, good hypertension control, good cholesterol control is very important. As for a pharmacological treatment, antiplatelet therapy with aspirin has significantly helped. It not only helps in peripheral vascular disease, but it also reduces all-cause mortality in these patients. That is, the risk of having stroke and heart attack is reduced in these patients. And there are medications which will improve the circulation itself to the leg, and these are silestazole and also pentoxifylline. And these medications, of course, have some side effects, and depending on patient's history, these medications has to be chosen accordingly.